नमस्ते। आर्या साहब नमस्ते।
अरे सर, नमस्ते नमस्ते सर। अरे
कैसे
नमस्कार
हो?
सर, नमस्कार सर।
सब खैरियत?
चलो ठीक है। अब थोड़ा
स्टार्ट
सा ना
कर दिया
5 दिन
आपने?
पहले अपन कंप्लीट कर लिया करेंगे ये वाली चीज।
यूट्यूब लाइव कर दिया साहब।
हाँ
यूट्यूब लाइव है। रेडी टू गुड टू गो।
हाँ,
अब
बता
होस्ट
दिया
कौन
गीता
बनेगा
पाठक
सब? शामिक सर को दे
की।
दो होस्ट।
क्या?
होस्ट शामिक सर को दे दो।
हाँ, शामिक सर को गोश्त दे दो।
ठीक है सर।
और रिकॉर्डिंग भी करना है।
लाइव लाइव।
ओके।
क्या देख लेगा सर वो? మేము కూడా ఉన్నాం రైట్ మాకు ఇయ్యరు ఇది అప్ప.
नमस्कार शिबू सर। सर
नमस्कार सर,
ज्वाइन कर लो।
नमस्कार।
ओके। नमस्ते रश्मि मैडम।
नमस्ते।
नमस्कार जी, नमस्ते नमस्ते मैडम।
अच्छा, अभी ज्वाइन करना था।
हाँ, थोड़ा जल्दी 5 मिनट पहले ज्वाइन करना था एक्चुअली। गीता पाटिल मैडम, नमस्कार।
Good evening, sir. Good evening.
गीता पाटिल मैम।
Good evening. Good evening. Good evening. I
जी।
joined purposely early. I told Prakash sir कि पापा जरा
सही बात है।
शुरू करिए, ये तो लेट हो जाता है कभी कभी बहुत।
ये कैसे लगाते हैं, मुझे सीखना है गीता पाटिल मैम। मेरा तो रिवर्स ही हो जाता है जब भी लगाती हूँ तो।
प्रकाश सर उनको टेम्पलेट भेज दीजिए।
हम्म।
टेम्पलेट भेज दीजिए तो।
गुड इवनिंग आर्या साहब, गुड इवनिंग। रश्मि
गुड
मैडम, गुड इवनिंग। गीता
इवनिंग।
पाटिल मैडम, गुड इवनिंग।
गुड इवनिंग सर।
हेमा बिंदु मैडम, गुड इवनिंग।
करते फोन कर।
डॉक्टर प्रकाश मेरे को टेम्पलेट भेज देना प्लीज। म्यूट हो आप।
हाँ बोलो।
आप म्यूट हैं आप, हाँ सॉरी।
हाँ
आप
हाँ।
मेरा टेम्पलेट भेज दीजिएगा मेरे को।
अच्छा ठीक है ठीक है।
ठीक है ना, रिवर्स टेम्पलेट।
हाँ जी हाँ जी।
थैंक यू।
हम्म। रफी को अपने पास बुला लो।
9-7 तो अभी ही हो गए।
नहीं नहीं मैडम, 8:52 हुआ है।
ओके, मेरा ये गलत
थोड़ा
बता।
ज्यादा है। नमस्कार संजय सर।
Madam, very good evening.
नमस्कार सर, नमस्कार सर।
Yes. Gupta madam, good evening. Hema Bindu madam, good evening.
गुड इवनिंग डॉक्टर संजय सर।
Madam, good evening. कैसे हैं आप?
ठीक है सर, आपको तो कहीं जाना था ना, ज्वाइन करने वाले।
Actually, unfortunately, every Thursday we have our woman wing of IAP used to arrange a Thursday thing. So today we have one session on thalassemia awareness at 9 o'clock.
ओके
So as a convener, I will just give the wishes there
ओके,
and I will shift. So that's why I join now. So
जल्दी जल्दी सबने
नाइस
ज्वाइन कर
सीइंग
लिया। थैंक यू सर, थैंक यू सर।
yes, Dr. Prakash sir, good evening.
हाँ गुड इवनिंग सर, गुड इवनिंग। अभी तो जून में बहुत बिजी हैं सर आप लोग, है ना?
Yes sir.
कॉन्फ्रेंस हो रही है आपके।
हाँ अभी थोड़ा सा मई थोड़ा वैकेशन मोड में रहता है,
हाँ
तो जून से शुरू हो जाता है।
लेकिन हमारी हेमा बिंदु मैडम ने तो है ना, मई में भी
यस
वेकेशन
यस
नहीं दिया,
मैडम, तो
आराम नहीं दिया हम लोगों को।
कोई आराम नहीं रहेगा। एएचए में कोई आराम नहीं। गीता पाटिल मैडम, गुड इवनिंग।
गीता पाटिल मैडम ने भी लास्ट ईयर बहुत काम किया था,
गुड
यस
इवनिंग
बहुत
यस
सर,
काम,
गुड इवनिंग,
बिल्कुल।
नाइस टू सी यू सर।
मैडम, गुड इवनिंग, कैसे हैं आप?
नमस्ते।
अच्छे सर, आपका बलूचिस्तान के बारे में का हमारे ग्रुप में पढ़ लिया।
हम्म।
पढ़ लिया ना?
हाँ सर।
प्रणाम लव सर, प्रणाम।
गौरी शंकर सर, गुड इवनिंग।
गुड इवनिंग। 9 बजे शुरू करना है ना?
हाँ जी सर।
हाँ yes.
नमस्कार सर, नमस्कार।
नमस्कार सर, गुड इवनिंग।
गुड इवनिंग डॉक्टर लव सर।
गुड इवनिंग।
सर के फोटोग्राफ लेने के लिए मैंने गूगल किया, गूगल में सर का नाम डाला, फिर उसमें से फोटोग्राफ निकाली, काफी पुरानी फोटो निकली। उसके बाद
यस
अमित
यस
भाई ने बोला कि नहीं नहीं, ये वाली नहीं, ये वाली डालो, लेटेस्ट वाली।
yes sir, you have done the commendable job because you have taken the photo from website. I see the flyer. I was amazed
सही बात है।
because we have posted our CV but we have not sent a separate photo.
हम्म।
Sukanta sir, good evening.
Good evening. Good evening. Namaskar.
Sir, how
नमस्कार
are you?
सर।
Fine. I think my video is not yet visible. It takes a little time.
Mahapatra sir, good evening.
Good evening, sir.
Good evening sir.
गुड इवनिंग महापात्रो सर।
Good evening, madam. Good evening.
गुड इवनिंग
नमस्ते।
सर। हम लोग जब मेडिकल कॉलेज में पढ़ते थे, तब टीचर्स और उनके भी इतना डरते थे, उनसे काफी दूर रहते थे। और इसमें तो हमारे इतने बड़े बड़े डिग्निटरीज हैं, वो मेरे
Teacher.
हमारे बगल में उनकी फोटो है। ओ नो, रियली बहुत अच्छा एक्सपीरियंस है ये उनके साथ।
ऐसे वे सर बहुत अच्छा प्लेटफॉर्म रहता है।
प्लेटफॉर्म बहुत
वेरी
अच्छा।
गुड इवनिंग।
नमस्ते
Good
मैडम।
evening to all.
Very
मैडम
good
वेरी गुड
evening,
इवनिंग।
sir.
सर कैसे हैं साहब?
बिल्कुल सभी ठीक है, बिल्कुल ठीक है मैम।
ठीक है सर। इवनिंग।
नेहा मैडम, गुड इवनिंग। हरीश पेमडे से ज्वाइन होने के साथ ना।
नमस्ते हेमा बिंदु मैडम। नमस्कार।
नमस्ते।
नमस्ते।
नमस्कार।
ठीक है
नाइस टू सी ऑल ऑफ यू। डॉक्टर आर्या जी,
मैडम, वेरी गुड इवनिंग।
सर।
नमस्कार।
गुड इवनिंग मैडम हेमा बिंदु मैडम, गुड
Good
इवनिंग, गुड
evening,
इवनिंग।
वेरी
नमस्ते।
गुड इवनिंग मैम, वेरी गुड
डॉक्टर
इवनिंग।
संजय देशमुख,
वेरी
डॉक्टर
गुड इवनिंग
गुड इवनिंग
समरेंद्र,
मैडम,
डॉक्टर
वेलकम।
संजय।
गुड इवनिंग मैडम।
रश्मि, एवरीबॉडी गुड इवनिंग। गुड इवनिंग मैडम।
गुड इवनिंग मैडम, गुड इवनिंग।
गुड इवनिंग, गुड इवनिंग।
प्रोफेसर हरीश पेमडे सर, नमस्कार। वेलकम
हरीश
सर।
जी, गुड
जी
मॉर्निंग, गुड
नमस्ते।
इवनिंग।
नमस्कार सर,
हाँ।
वेलकम सर।
गुड इवनिंग हेमा बिंदु मैडम, गुड इवनिंग।
गुड इवनिंग सर, गुड इवनिंग सर,
अरे सर
वेलकम।
देखिए
हरीश सर, गुड इवनिंग, वेलकम सर।
समरेंद्र
दो
जी,
दो
बहुत दिन
दो
हो गया,
दो
हाउ आर
सर
यू?
आप।
नमस्ते जी।
मैडम।
गुड इवनिंग एवरीवन।
डॉक्टर संजय देशमुख जी।
यस सर, गुड इवनिंग मैडम, गुड इवनिंग।
हरीश पेमडे सर, गुड इवनिंग।
गुड इवनिंग, गुड इवनिंग।
हरीश सर, गुड
जलील
इवनिंग
सर,
मैडम।
डॉक्टर जलील सर, गुड इवनिंग।
ऋषभ
डॉक्टर शिबू, शिबू और ईबी मेंबर गीता पाटिल
हाँ
मैडम।
सब लोग जाएंगे।
गुड इवनिंग एवरीवन।
गुड इवनिंग, गुड इवनिंग।
गुड इवनिंग मैडम, गुड इवनिंग।
गुड इवनिंग।
नमस्कार मैडम, सभी को नमस्कार। सुधीर मिश्रा।
नमस्ते सर, गुड इवनिंग।
नमस्ते हरीश सर, कैसे हैं?
गुड इवनिंग सर।
डॉक्टर समीर
गुड
सर।
इवनिंग
बढ़िया हूँ सर।
सर। डॉक्टर समीर शामिक घोष जी एंड डॉक्टर आर्या सर,
हाँ
can you
सर।
please call up our past chairperson sir? Actually they require one phone call. Dr. M.K.C. Nair
कैसे
sir,
उनको फोन
Mr.
किया था
प्रजापति sir.
सर, आज बिजी हैं, नहीं आ पाएंगे वो।
अच्छा अच्छा।
हाँ उनको किया था
प्रजापति
और
सर, गुड इवनिंग। नमस्कार सर।
नमस्कार।
नमस्कार।
नमस्कार प्रजापति सर, वेरी गुड इवनिंग।
नमस्ते एवरीवन।
डॉक्टर वाइकर,
नमस्ते
नमस्ते।
9 बज
गुड
गए
इवनिंग
मैडम,
टू
स्टार्ट
ऑल।
कर रहे हैं।
Just 2 more minutes sir, I think just 2 minutes. Sushma Desai ji, जो गीता मैडम has joined. Singarelu sir,
गीता
good
मैडम 10 मिनट
evening.
पहले आ गई थी मैडम टाइम से।
गुड इवनिंग, ऑल द बेस्ट, ऑल
Good
द
evening sir.
Good evening, sir.
Good evening, Hima Bindu
Good evening,
madam,
sir.
and good evening, everyone.
Good
Good evening, Geeta
evening,
Patil
good
madam.
evening, Geeta ji.
Good evening.
Sir, we'll wait. Vaikari, good evening. Special welcome.
हाँ
Vaikari, nice to see you, Vaikari.
यूथ वॉइस हमारी
Your
youth,
parents have not joined. Your father has
youth
not.
voice.
He's traveling
Yeah.
to Bangalore, so he may not be able to.
So nice of you.
Oh yes,
Yeah.
tomorrow is our class, vaccinology. Correct.
Yeah.
I'll meet him tomorrow.
प्रजापति सर को नमस्कार. Nice to see you.
Sir, we should start the meeting, sir.
हाँ sir.
Dr. Arya.
Yes,
Dr. Arya.
Yes,
Yes, it is 9 already.
Good evening. In the series of monthly webinar, super specialty webinar on ophthalmology, I, Dr. Prakash, formally welcome you all attending this very important super specialty webinar on ophthalmology. I welcome our guest from CIAP in absentia, President Dr. Vasant Khalatkar, sir, President-elect Dr. Neelam Mohan, madam, and Dr. Vasav Raja, sir, immediate past President. Treasurer Atanu Vadra, sir, and Secretary Yogesh, Dr. Yogesh, sir. Then I welcome all chairperson of AHA, Dr. Hima Bindu, madam, Geeta Patil, madam, Sushma Desai, madam, and Dr. Harish Pemde, sir, as a guest of honor, and Dr. Sukanta, sir, as a past president. I also welcome Joint Secretary Dr. Samir Ghosh and the Treasurer Dr. Sneha Gadkar, madam, and all EBs and of various zone attending this meeting. आंखें भगवान के द्वारा प्रदत्त की हुई बहुत ही खूबसूरत उपहार हैं एवं हमें इसे बहुत ही संभाल कर रखना चाहिए. किशोर वय में होने वाली आंखों की परेशानियों को हम समझें, अर्ली डायग्नोसिस एंड ट्रीटमेंट की दिशा में आगे बढ़ें. अब मैं इनवाइट करता हूं हिमा बिंदु मैडम को ओपनिंग रिमार्क के लिए एंड वेलकम के लिए. हिमा बिंदु मैडम.
So, thank you, Dr. Arya ji. I welcome on behalf of.
Ma'am, you are mute. Hema, ma'am, you are mute.
Yeah, on behalf of Central AHA, as a chairperson of the Silver Jubilee year this year in 2025, it's my honor and privilege to welcome all the seniors and colleagues of IAP and AHA. This is the series of super specialty webinars being conducted by Central Adolescent Health Academy. So we decided to have super specialty topics this year. So we are going beyond the routine topics. And therefore, we are choosing something with little different super specialty topics. So I really thank Dr. Sudhir Mishra, sir, who's our chair of the scientific committee of AHA, and his team for having chosen good topics and good faculties. I would like to specially welcome all the seniors, our past chairpersons and central IP office bearers. And especially, I would like to, I'm seeing Dr. N.C. Prajapati here. I'm so excited and happy to see him. Sir, we all are really, we get very motivated when you come and bless us. And thank you for your presence. I really appreciate the presence of our Vice President from Central IAP, who's our guest of honor today, our very own past chairperson of Adolescent Health Academy, Dr. Harish Pemde. We welcome you, Dr. Harish Pemde ji, who's a guest of honor today. I can also see Dr. Atanu Badra has just joined, our National Treasurer from Central IAP. Atanu Bhai, thank you for taking your valuable time to join us, the Adolescent Health Academy webinars. We welcome you and all my colleagues. And actually, I want to put on record again the efforts of Dr. Sudhir Mishra, sir, and the team to select our topics so diligently. Thank you, sir. And I want to acknowledge the presence of our past chairperson, Dr. Sukanta Chatterjee, sir. Thank you, sir, for your presence. And of course, Dr. Geeta Patil, madam, and Dr. Sushma Desai, madam, will be joining us shortly. Now, with these few words, I would like to also mention that apart from this super specialty webinars, I request all the members of AHA and also the IAPNs to please encourage our chapter who's celebrating the Silver Jubilee year this year. We are celebrating the legacy of all the past chairpersons who have contributed so much to the growth of Adolescent Health Academy for the last 25 years. So this year, we are really trying to make some impact and difference. We have started some unique projects like involving the youth themselves, because we are working for the youth. We have been training and doing capacity building of our pediatricians through many workshops and programs throughout the last 25 years. Now I think it's time to really establish clinics for them, to establish health centers where they can access healthcare, to involve the youth in all our decision making, in on policy making, all our webinars. Let us hear their perspective also. So we took a bold decision this time to also establish a AHA Youth Forum, where we have been connecting the youth over. We have around 200 youth with us already connected. So this will be expanding, I hope, in the future. So we have today our young youth, Vaikari Sonavana. I think we should give a big round of applause to her for her presence today. And in this, you are a very special guest, I should say. Vaikari, thank you for being with us. And we also will hear you. Feel free, they're all very big pediatricians here, experts on adolescent health. But we would like to listen your voice. Okay, we welcome you. Special
Very
welcome to you.
intimidating. Thank you so much for having.
Thank you. And this year we're also running through the action plans, which has the youth wellness as one of the core area. We are taking up 4-5 topics of priority: the sexual wellness, the metabolic wellness, the mental wellness, and digital wellness. We thought we have to really do capacity building in those 4 topics, along with vaccination. We shall be training our pediatricians and request them to go to the colleges and schools beyond June, so that we develop some ground, we can make some impact there in the ground. We're also trying to do research projects. 2 research projects today only myself and Dr. Geeta Patil have finalized, and we'll be running through 4 to 5 centers in the country. So we are also doing this parenting section. The Adolescent Health Academy in the website, we have opened a section for the parents, and we have uploaded frequently asked questions. The answers to the FAQs by a committee, by the AHA. So we uploaded, and we are going to release this actually this Sunday over the Wave 18 program. Now coming to the Wave 18 program, this is a unique program where 18th of every month, we are announcing this as a Youth Wellness Day, because that is the day, 18, the young people, adolescents always look forward कि हम 18 कब बन जाएंगे. So we want to celebrate this Youth Wellness Day. It has caught the attention of UNICEF, and UNICEF is now collaborating with us, joining hands with us to celebrate all this Wave 18 days. So please do join us on all our webinars to see this, spread of this Adolescent Health Academy awareness activities throughout the country. We also have a boy-child module. We have a parenting updated module coming up, and many other things happening. And we want to start this Yuva clinics, somewhere at least few of them across the country. So we are going to have some orientation and kickstart this activity through the HODs of the medical colleges. So these are the few things what we are doing. And now I request Dr. Atanu Bhadra, the Central IAP Treasurer, on behalf of the Central IAP, to give us the blessings and few words for the AHA, which is now celebrating its Silver Jubilee.
Thank you, ma'am. So the topic is really attractive. That induced me to leave my work and join to just hear this. So I thank the scientific team to picking out this topic. And of course, congratulations to AHA bringing out a whole lot of work and whole lot of modules that are very important. And in the future, I think when you were focusing on these issues and even the non-communicable diseases, the world organizations like UNICEF and WHO are also focusing on that. So I would request AHA to take the lead, which they are already doing, take the initiative and just continue. We are there with you. Thank you. And a special welcome to Vaikari. She was my co-panelist in Nashik. And
wow.
Well, we are doing great. Ravindraji keeps me updated about your movements. So thank you for joining AHA.
Thank you, sir.
Thank you. I request Dr. Harish Pemde, sir, our guest of honor and our past chairperson of Adolescent Academy. We know him as our own member of AHA. He has done a lot of work for adolescent health and our colleague. So he is the vice president now from the North Zone. And I'm sure he has done a lot of, associated with a lot of activities, organizations. He's also representing the IAP-AHA, IPA, whatnot. But Harish Pemde, sir, please, your words of advice,
Thank
suggestions
you.
for the HA and blessings for this program.
Thank you, Dr. Hemavindu. I have certain observations in this 25th or Silver Jubilee year of AHA. And I find that there are 6 beautiful eyes who are leading the AHA today. 3 women who are leading, the current chairperson, Hemavindu, the past Dr. Geeta Patel, and future Dr. Sushma Desai. What a coincidence in 25th year. Congratulations to all of us and AHA.
Thank
That is
you.
one thing. And this series of various topics which are very less covered or almost not covered in various educational activities, and you are doing this kind of innovation today. You also listed several other innovative programs. Okay, so what I want to say here is that AHA has a tradition of, I would again say, 2 eyes. Improvement through innovations. So innovative programs should always be there, and we need to continuously innovate and improve our whatever we do at AHA, because this subject of adolescent health is still evolving after 25 years in India, and we are becoming wiser and wiser by every passing day with every program. And we need to continue this for many years also now. Although there are certain things, certain agendas which are yet to be completed, like having a NMC recognized course in adolescent medicine. It's one that agenda which we all have to work continuously. Then only our subject will get improvement and its respect amongst practitioners and amongst population also. But congratulations to you and the team AHA who are doing various innovative programs. And I'm sure the participant will be very, very beneficial of today's program and future programs also. Thank you so much.
Thank you, Dr. Harish Pemdeji. Thank you for those words. We feel very nice when our own people have become the vice presidents. You, Dr. Preeti Galgali, Prashant, all of you are doing
And
so.
we will definitely like our people becoming presidents.
Thank you. Thank you so much. Thank you once again. And now over to our Sudhir Mishra, sir, who's the chairperson of Scientific Committee, to say a few words and please guide through the program, sir.
Thank you, ma'am, for your kind words. Right in the beginning, I would like to welcome our chief guest for the day, or guest, Dr. Harish Pemde. Thank you, sir, for your presence. Now, I would also like to place on record my appreciation for the scientific committee, the EBs, and the president man for together with me, culling the scientific program in the way it is going on. And if it is appreciated, it's a credit to everybody. Thank you for your kind words, ma'am. Now, we have 2 ophthalmologists today. One is Dr. Love. I'm not taking his surname for the fear of pronouncing it incorrectly. Pardon me, sir. And Dr. Poonam Singh, who is from Jamshedpur. Dr. Love is from Kolkata. Dr. Love is a founder director of Netralayam Hospital, which is an excellent ophthalmic center at Kolkata. He was assistant medical director of the Shankar Nethralaya Kolkata earlier, and then he separated from there. In fact, he has a huge role in the development of Shankar Nethralaya and where it stands today. He incidentally is a pediatric ophthalmologist in addition to doing the routine ophthalmic work. Welcome, sir, and I wish to listen to you in coming 15-20 minutes. Dr. Poonam Singh is a consultant ophthalmologist at Tata Main Hospital, Jamshedpur, a good friend.
Yeah, so we have a lecture.
She has been doing great work in ophthalmology, especially in the fields of glaucoma and in pediatric ophthalmology. So I welcome you, Dr. Poonam Singh. Our moderator for panel discussion today is Dr. Rashmi. She is from Gwalior, a pediatrician, a very active pediatrician. She is MD FIAP and has held various positions in IAP as well as AHA. Currently, she is the EB member of the AHA. Welcome, Dr. Rashmi. And without delay, I would like the scientific session to start. Thank you, everybody.
You. Sir, before we start, can we have one word from Dr. Geeta Patil, Dr. NC Prajapati, Dr. Geeta Patil, madam?
Sure.
So, thank you very much, Dr. Himabindu madam, for arranging.
Ask them to call.
Arranging these programs, which are really unique. Now we have to move on. Thank you very much, Dr. Atanubhadra sir, Harish Pemde sir, Sukanta sir, and all the seniors who are here. It shows so much interest in this topic, and we have rightly selected a ophthalmologist, pediatric ophthalmologist, and we are going to learn beyond refractory errors, allergy, trauma, infection. Now time has come to know about the digital eye strain, computer vision syndrome. We are facing a lot of issues after that. And I think we are going to hear a lot about that. And I really thank Dr. Atanubhadra sir and Harish Pemde sir taking their time out, and wish you all the best for this program, all the panelists who are so eminently, who are all eminents and moderator. This is going to be really a fruitful and very informative session. And I congratulate Vaikari. She herself can tell her achievement. I think Dr. Vaikari, you are there? She's
Yeah, she's there.
So she's been selected
there.
in some very prime place. Maybe I don't know whether she is going to opt for that. She only will tell us later on. Congratulations, Vaikari.
Yeah,
Maybe I may not be able to tell
Thank
correctly
you.
where it is. Thank you very much.
Thank you, Dr. Geeta ji, for your presence and blessings. Sir, NC Prajapati, sir, you're such a senior person, and we have seen you after after a long time, and you have been a past DME of UP, and we know you so well. Please, a few words from you, and then we can start. Sir, unmute. आपकी आवाज नहीं आ रही है सर. Dr. Prajapati, sir. You're unmute. Voice is not coming. You're not able to hear you, so you can text in the chat box otherwise. Yeah, thank you. So over to the scientific program. Dr. Shamik and others, please start the program. So Dr. Sudhir sir has already introduced both the ophthalmologists.
Yeah, Dr. Love has already been introduced, and request Dr. Love Petskova to share the screen and start the proceedings.
Can you see my screen?
Yes, sir. Your screen is visible and you are audible.
Thank you. Thank you. First of all, thank you so much. And especially thank you, Dr. Shamik Ghosh, for introducing me to all of you. It's an honor to present on this forum. So the topic what I would be speaking on is computer vision syndrome. And broadly, I think all of you know what it is, but I will try to go a little bit in detail so that it becomes easier for you when you are dealing with your patients. So how do we define it? See, just a simple definition. It is a temporary condition resulting from focusing the eyes on the computer display for protracted and uninterrupted periods of time. So with this, it is more or less clear that it is not a disease of the eye. It is a lifestyle related problem which leads to strain and problems in the eye. Symptoms, what we see in computer vision syndrome is eye strain, headache, blurred vision, fatigue, and due to improper posture, you may have neck and shoulder pain, back pain, dry, irritated eyes, difficulty in refocusing, and sometimes double vision. So these symptoms are actually get further aggravated with improper lighting conditions and air movement past the eyes. If one of the important features is air conditioned room also, which leads to dry eyes. So how does it, what is the pathophysiology behind this? It is due to the decreased blinking reflex and the number of blinks that we have per minute while working long hours and focusing on the computer screens. The normal blinking rate, which we don't realize generally, is around 16 to 20 times per minute, but we don't realize that we have been blinking so frequently. But while working on the screen, this comes down without us knowing about it. It comes down to 6 to 8 blinks per minute, which leads to dry eye and the related symptoms. Second important thing that leads to this computer vision syndrome is near focusing for a prolonged period leads to a strain in the ciliary muscles, which are responsible for accommodation and near vision. So this induces asthenopic symptoms. By asthenopic symptoms, we mean strain, what we feel in the eyes after working for long hours on the screen. How big is the problem? So two groups, if I'm considering here, one is office goers, in which almost the studies have shown that eye strain and visual symptoms occur in 50 to 90% of the computer workers. And in children, data in American Child now shows that 1 to 3 hours per day of computer work during doing homework, talking online, playing games, and chatting with friends. So adolescents spend almost 1 to 3 hours on an average on digital screen daily. And even more alarming is that almost 100% of adolescents who are school-going children are working on computer or digital screen. Another factor away from this topic is that this is leading to a very high incidence of myopia or minus power in children due to prolonged use of computer screens and mobile screens. So how do we prevent it? So these are some of graphic representation of the steps that should be taken, and I would go one by one on all this. But just brief in simple terms, we have to tell our patients to try to blink very frequently and blink consciously when they are working on the screen. Take a break after a certain period of time, and other features what we are going to discuss now. So I would go ahead with 10 points, and it will which will deal with the measures that we should take in preventing computer vision syndrome. So first and most important would be to get an eye checkup. And anyone who is working on the computer, even if they are not having symptoms, should have an eye checkup first, because that will help the doctor to treat any refractive error or any dry eye can be identified well in advance. So that is the first step. Second step, use proper lighting. So by lighting, what we mean is the surrounding light. If we are working on a screen and if it is a very bright light from exterior or outdoor sunlight, then you will have a digital eye strain. So when you are using a computer, your ambient light should be little bit dimmer than what you are generally used to. Eliminate all exterior lights by closing drapes, shades, and blinds. Reduce the interior lighting by using fewer bulbs or fluorescent tubes and lower intensity bulbs. And if possible, position your monitor in such a way that a window is not in front or behind your monitor. It should be on the sides. So that is in brief about lighting when you are working on a digital screen. And this have to be taken care of because that is a part and parcel of your life, and you have to do it daily for years together. So these are important factors which should not be missed. Third will be to minimize the glare. So glare on the walls or finished surface as well as reflections on the computer screen also cause computer eye strain. So what we can do, we can install an anti-glare screen on the monitor, and if possible, bright white walls, paint bright white walls with a darker color with matte finish, so that when you whatever is in front of you apart from the screen does not give glare in your eyes. Cover the windows, which we have already discussed. And when we wear spectacles, we can use anti-reflective coating applied on your lenses. If you see our spectacle lenses, sometimes you will have a bluish tinge in the spectacles. So these are anti-reflective coating which are on our spectacle lenses, and that helps in reducing glare while working on the screen. Fourth, I think the days of CRT is gone, but just to make a reference that if you have not already done so, the old tube style monitors should be replaced by flat panel monitors. And the latest computer in which you see that the light keeps on, the screen light keeps on changing with the intensity of the ambient light. That is the ideal way to do it. And in the old CRT screens, what would happen? That flicker of images on the screen used to cause eye strain, which is much less in the present LCD and LED screens. Fifth will be to adjust the brightness of the screen. So that is what I was telling just a moment back, that if you have that automated feature in which with the surrounding light, the brightness keeps on changing, that goes a long way in helping reducing the digital eye strain. But if it is not there, then adjust the display settings of the computer so that brightness of the screen is about same as your work environment. And as a test, try looking on the white background of this presentation. If it is looking like a light source, that is you are having glare, then it is a bit too bright. And if it looks too dull or gray, then it is too dark. So somewhere in between will be the ideal brightness of the screen. This, I would say, is the most important factor. We have to blink more often because we have a normal lubrication of our eyes with blinking of the eyelids, and it re-wets the surface of the eye. And that is why we blink almost 20 times per minute. But when we work on the computer, we blink less without knowing about it. And studies have shown that it is almost 5 times less. That means if it is 20 times, we are blinking hardly 4 to 5 times per minute. So that leads to dryness of the eye and digital eye strain. And if frequent blinking is not working, then we can temporarily give some artificial tears till the inflammation of the eye comes down. And then the tears can be slowly withdrawn, and when we get used to frequent blinking. Seventh is the very common 20-20 rule. I think many of you would have heard about it. And why we have named it as 20-20-20 rule? Because it becomes much easier to remember for people who are dealing with digital eye strain. So, and this gives a proper rest to the eye. The eyes keep lubricated, and helps in relaxing our ciliary muscles and replenishing our tear film, which were the two most important factors in the pathophysiology of digital eye strain. So by 20-20-20, what do we mean? That every 20 minutes, focus on some distance object at 20 feet or whatever distance we want, and for about 20 seconds. So this will help in breaking the pathophysiology of the dry eye the digital eye syndrome, and your overall efficiency while working on the computer screen will also increase. It is not a waste of time; it is just an investment that you need to make your eyes healthy. And one important point here is if looking at distance is not feasible for the patient, then you can just close your eyes for about 20 seconds every half an hour. Take frequent breaks to reduce the risk of computer vision syndrome. This is the point number 8. And to reduce the risk of computer vision syndrome, and we should take a break, maybe depending on whatever you are comfortable with. And many workers take only 2 15-minute break from their computer throughout their working day. But according to a recent study which was conducted, the discomfort and eye strain were significantly lower when a computer worker takes 4 additional 5-minute breaks, mini breaks throughout the day rather than 20 minutes break of 2 times. 9, very important, because for years together we have to work on computers. So ergonomics become very, very important, and in which your spine should be straight, your computer screen should be slightly lower than your eye level, so that you are not bending your head too much, which will lead to spondylitis otherwise. And this also helps a lot in the reducing the syndrome of computer vision syndrome, which includes back pain, neck pain also. And finally, the computer vision spectacles. And this I had already spoken that depending on your age group, since we are speaking about adolescents, the one important thing is proper refractive error correction, and anti-reflective coating on the spectacles may help, or blue light blocking feature is also there, which leads to less strain in the eyes. So these can be done. And for presbyopic age group, the spectacles power has to be adjusted for the distance of the computer screen. Suppose if you are keeping the screen at 45 centimeter or 60 centimeter and you are used to that working distance, then normal bifocals will not work, because that is made for a 30 centimeter distance. So we have to make a spectacle especially progressive, which includes an intermediate zone also, which will take care of the working distance for the computer. So that helps. That also helps a lot in reducing the computer vision syndrome. I think that's all I have to say on this. Thank you so much for the attention.
Thank you, Dr. Shamik. Thank you so much. I think that was very useful, especially the topic, since this digital area for young people, they are exposed like anything. Over to you, Shamik. Yeah, we are waiting for you.
Yeah. Now, I've been listening. Thank you, Dr. Love, for a very simple and a very lucid expression of the problem. I'm sure there have been quite a few takeaways. We will not, we will wait. I think so, ma'am, let us finish the all the sessions and then we can take any questions.
Sure. I request you to stay on, Dr. Love, for the expert comments. So I think we'll move with the panel first, and the youth is also waiting.
Yeah. So can I request Dr. Rashmi Gupta, who's already been introduced by Professor Sudhir Mishra, to start the panel discussion with the panelists and introduce the panelists.
Shmiji is our executive board member.
Yeah, I'm sorry, something happened. Should I share it again?
We are able to see.
आपका स्क्रीन ये कर दीजिए, स्लाइड शो पे कर दीजिए रश्मि जी.
सुषमा जी, वेलकम.
Thank you.
फुल स्क्रीन करिए मैम.
Acknowledge our presence of the President-elect, Chairperson-elect of AHA, Dr. Sushma Desai ji.
Thank you, Hima ji, for acknowledging.
Dr. Rashmi, there is an icon called Use Slideshow. If you can go there and click on that.
Okay. Can you see the slides?
Yeah, we can.
Okay. Then I'll start.
Top left-hand corner.
Ma'am, full screen कर दीजिए, please.
Okay, it's not full screen.
Third icon from left.
I don't know, something is happening.
On the main slide, first slide.
मैम योर
Upper,
कर्सर इज ऑन एंड शो, उसके बाद टिप्स हैं, उसके बाद व्यू स्लाइड शो।
उसके
ऊपर देखिए
नहीं, लेफ्ट
या फिर
देखो,
नीचे, या फिर नीचे वो आवर ग्लास है ना, उसको कर दीजिए क्लिक।
मैं दोबारा से करती हूँ इसको।
ऊपर है देखो, यू स्लाइड शो on the left, or left.
Go to the extreme left of your screen, ma'am.
I'm wasting time really.
अरे
What
वो
can
टिप्स
you
के
see है?
पास में रश्मि जी,
मैडम
तो
आप
आप अभी
इंट्रो
क्या
का
देख
क्लिप
पा रहे हो?
प्ले कर
अभी
दें।
आप क्या देख पा रहे हो? आपको स्क्रीन में क्या दिख रहा है आपको?
हमको प्रेजेंटर व्यू दिख रहा है आपका।
हाँ ना, वो अभी अभी मैडम शुरू कर दीजिए आप फिर से
फिर से
लॉगिन कर।
स्टार्ट करते हैं।
संजय देशमुख जी आप कर लो ना शेयर, पार्ट ऑफ ऑल द पैनल शुड
Now
हेल्प।
can you see?
यस मैम, बट फुल स्क्रीन कर दीजिए प्लीज।
इसमें आपके पिक के
हाँ
नीचे
बस
ये
बस
स्लाइड शो
थर्ड
बना हुआ है
आइकन,
ना।
लेफ्ट से
हाँ,
थर्ड।
और इससे और
नो
लेफ्ट।
नो नो नो, लेफ्ट से थर्ड।
सीसी के बगल वाला, सीसी के बगल वाला।
इसके
हाँ,
हाँ ये वाला।
नहीं,
नहीं
इसके
नहीं,
पास
इसके बाद
ऊपर
वाला,
से ऊपर आएगा।
इससे
ऊपर
पहले
ये
वाला।
मैकबुक है क्या
हाँ, ये
रश्मि
हाँ
जी?
ये वाला।
हाँ, मैकबुक है ये।
यार तो मैकबुक में ऊपर नहीं आएगा, मैकबुक में नीचे आएगा। इसमें लिखा है जूम वाला, वो फुल वाला। करिए ना वो।
देखिए लगे
I'm wasting time. Why this happened?
हाँ बस 3 पॉइंट को क्लिक कीजिए, नीचे जाइए, यूज स्लाइड
नीचे,
शो करके लिखा है।
यस यस यस,
हाँ।
चलिए, हाँ आ गया, बस हो
या
गया।
दैट्स ग्रेट।
यस
Okay, thank you everyone for
मैम गो
getting
बैक,
me
इट हैज
for the
गॉन बैक।
show.
Ma'am, you have
प्लीज
again
रीडू।
clicked
I'm sorry,
presenter
I
view.
wasted 10 minutes. Can you see?
No,
We can see,
मैम
we
madam, but
need
go
the
back
full
again.
screen.
You have to go to slide show.
इट हैज।
No, 3 dot. हाँ, yes.
हाँ हाँ
Yeah, slide
लास्ट।
show. Yes, that's it.
यस
बस अब
हाँ
हाथ
ये फाइन।
So thank you everyone for guiding me. Thank you everyone for guiding me. And first of all, I should extend my thanks to Dr. Harish Pemde sir for being a guest of honor of this, and Dr. Tanu sir and Dr. Prajapati sir for honoring us for this for the presence in this webinar. And also I extend my thanks to Dr. Himabindu ma'am, Dr. Shishma ma'am, Dr. Geeta Patil ma'am. Oh, what is happening?
No, everything fine, ma'am. Go ahead.
Dr. Himabindu
हो
ma'am.
गया, कंटिन्यू करिए।
Yeah, correct. Dr. Himabindu ma'am, Dr. Geeta Patil, Dr. P.V. Arya sir, and Dr. Sneha Gadkar and all. And I should extend Shamik Ghosh sir also. And I extend my special thanks to Dr. Sudhir Mishra sir for guiding me, being a good guidance for this. And because of him only this could happen. Now, you know that today's topic is common eye problems in adolescent. Okay. So this adolescent problem is very difficult. And it is very important to know about the adolescent problem because I'm going to disturb everything. Because you know that adolescent, I'll go to the next slide, I'm wasting time. So these are our esteemed panelists. Actually, I had written about them in the presenter note. So I'm sorry, I'm not able to read it out. So Dr. Poonam Singh, ma'am, already Dr. The Shami Ghosh has told about her. And Dr. R.N. Sharma, sir, he's a renowned pediatrician from Agra. And he is like, he's a pivot, still he was honorary secretary of AHA 22-22-23, and he's still a pivot for RN Sharma for this central AHA. And today also he's running this program. Thank you so much, Sharma sir. Dr. Sanjay Deshmukh sir, I'll have to read out. Dr. Sanjay Deshmukh sir is a consultant pediatrician neonatologist from New Era Mother and Child Care Hospital and Deshmukh Child Clinic. To his credit, he is twice selected as a EB member of Central IAP, and he is also EB member of Maharashtra Zone, and he is EB member of COMAT UK also, and he's a faculty, international faculty in various organizations. And Dr. Samrendra Mahapatra sir is a professor and head pediatrics AIMS Bhubaneswar. He has also received PGDAP from Kerala University. There is more than 75 publications in his name. Now, today's content for this panel discussion is refractive error, glasses vs contact lens, LASIK, difference between allergic and infective conjunctivitis, strabismus, amblyopia, common eye injuries, and keratoplasty. So from this pie diagram, you can see that 80% of childhood blindness occurs in the Asian country. And you can see the magnitude of problem, and the studies says that 30 to 40% of Indian adolescents are myopic. From this, you can make out that how important this topic is for us to know the basic ophthalmology. And the structure of eye, I will not go in detail, but by this video can make out the function of the
Inside the eye are various structures working together to create an image the brain can understand. Among these are the cornea, a clear dome-like structure covering the iris or colored part of the eye, the lens directly below it, and the retina, which lines the back of the eye. The retina consists of thin layers of light-sensitive tissue. This candle can help us understand how the eye captures images and then sends them to the brain. First, the candlelight passes through the cornea. As it does, it's bent or refracted onto the lens. As the light passes through the lens, it's bent a second time. Finally, it arrives at the retina, where an image is formed. This double bending, though, has reversed the image and turned it upside down. If that was the end of the story, the world would always appear upside down. Fortunately, the image is turned right side up in the brain. Before that can happen, the image needs to travel as impulses along the optic nerve and enter the brain's occipital lobe. When the image forms there, it regains its proper perspective. Now let's consider two.
So let us start with a case. A 10-year-old Nakul, who is a very smart and sharp boy, but is allergic to pollen grain. His writing speed is very poor in school, but good at home. Parents are worried because he is not able to score marks as their expectations. So Nakul must be suffering from myopia with allergic conjunctivitis, and it may be progressing to amblyopia. So at adolescent, when his vision and his aspiring for success and happiness, this is very necessary to take care of Nakul. And this is the adolescent eyes, and so we have to take care of it. Now, first question goes to Dr. Poonam ma'am. How would you define refractive errors in adolescent? Dr. Poonam ma'am?
Yeah, first of all, I would like to thank the organizers for giving me this opportunity to be a part of this panel. So, whatever we are seeing, it is because the rays of light which are coming from infinity are basically focusing at a particular point in retina. If they are focusing at a particular point in retina, the image is sharp and clear, and this is known as ametropia. That means there is no refractive error. But at times, this image may fall slightly in front of the retina, or it may fall slightly behind the retina. This condition is ametropia. And if you see these slides, the lowermost picture, if you see, the light rays are falling slightly in front of retina. So this is a nearsightedness because the rays are not able to reach the retina. The patient will be seeing better at near, but for distance, the vision will be blurred. So what we have to do is that we want to correct this by making these rays of light to reach the retina. Whenever we want to, applying a little bit of physics here, we want to diverge these rays so that they reach the retina. So we are using the concave lenses, which are basically minus lenses. So in myopes, we are using minus lenses to correct the refractive error. Whereas if we come to the second picture, which is in between, the rays of light are converging beyond the retina. So again, this is known as farsightedness because the patient is able to see good at distance, but for near he will have problem. Now we want this light to come little behind and fall on retina so that we can see the best image. For this, we want to converge the light, so we are using a converging lens, which are plus lenses. So in hypermetropes, we are using plus lenses. So there is another condition when the rays of lights are falling on retina, but they are falling on different points. So we are seeing images, but for correct imaging, we need to use some cylindrical lenses. So basically, there are three types of refractive errors: myopes, hypermetropes, and astigmatism. Yes, ma'am.
Thank you, Dr. Poonam. Thank you, Dr. Poonam, for giving a overview of this refractive errors. Now, the second question goes to Dr. R.N. Sharma, sir. Sir, tell us what are the symptoms of refractive error? Dr. R.N. Sharma, sir?
Yes, ma'am. Thank you. Thank you very much, ma'am. Thank you, IAP-AHA, for giving this opportunity and making us expert ophthalmic surgeons, physicians. Thank you. And the symptoms of refractive errors depends upon the severity of error and types of error. And the most common symptom in adolescent or children is blurred vision. And sometimes they don't know the severity, and parents usually do not know severity, and they are unaware with the refractive errors, and they comes for another opinion or consultation, and accidentally we found he or she is having refractive errors. So that is asymptomatic refractive errors, and repeatedly rubbing the eyes every time, this may be symptom of refractive errors, and frequent headaches, especially after visual tasks. This is also a important cause of refractive errors. Repeatedly blinking, difficult with distance judgment, with affected sports activities, performing other activities, and eye strains, and double vision is also a symptom of refractive errors, as ma'am said. Glare of halos around lights. This can be particularly noticeable at night. This may be a symptom in elder patient like cataracts, etc., and other adolescents, and difficulty in focusing and at any topic, and symptoms of myopia, needing to sit closer to the TV or blackboard, difficulty in driving and playing sports due to near vision, and in hypermetropia, and hold reading material further away. So difficulty in near vision, difficulty with tasks requiring near visions, and astigmatism. There is no visual acuity. Eye is not focusing at any points. So always adolescent or any child always have blurred vision in astigmatism. Eye rubbing already told, tilting of the head, repeatedly tilting of the head is for seeking the correct vision and correct reading or work, holding objects close to eye, lack of interest in schoolwork and reading. This also may be a sign of refractive errors. Other signs already told, schoolwork, academic performance decrease, and behavior changes such as irritable or frustration. One case I would like to mention here, a 13, 14 years girls come to me after consultation with many doctors last 6 months. She consulted neurosurgeons, She consulted psychologist and many other doctors. And after complaint was only headache. And she come to me and I thoroughly examined. Nothing was seen. And after examining the all investigations, CT, MRI, etc., I found she was not investigated for the refractive error. Then I immediately sent to eye surgeon, and she is corrected with, she was having refractive error and corrected the refractive error, and response were given 3 to 4 weeks. So we should think whenever a adolescent or any patient come to us, we should first see and think the common problems, not the highest problem. Next, ma'am. Yes, I have short span already told, losing their reading place and losing lines repeatedly due to this is maybe a complaint of symptom, avoiding reading and other close activities like drawing, playing games, etc. And turning point already said, repeatedly turning, this may be due to in astigmatism. No focus is seen in astigmatism.
Thank you, Dr. Arun Sharma, sir. You also applied your knowledge to an adolescent, and he was deal with the ophthalmologist at timely treatment he got. So, Dr. Sanjay Deshmukh, sir, are you there? How would you diagnose refractive error?
Good
Dr.
evening.
Deshmukh, sir.
Yes, good evening. Thanks for giving me opportunity as a general pediatrician on this prestigious AHA platform. My esteemed co-panelist, Dr. Sharma sir, has rightly said, there are a lot of symptoms which are not diagnosed in day-to-day practice as a general pediatrician, because this is the most common and most neglected in our practice to diagnose refractive error in adolescent. And the reason Dr. Sharma sir already told, they never come to you with the cheap complaint of any blur vision or any other symptoms. So what I always think, there should be as a clinician, we should have that approach in our practice. No matter if the adolescent patient come to you for routine illness, in your waiting area, you can just tell your one expert to check the vision by simple doing the visual acuity test. It's very not difficult thing, and that's why we can pick up the common refractive errors. And the medical history, as you know, in adolescent, they are always shy to give the history, what happening in their life. And rightly said by Dr. Sharma, the school performance is declining. They try to avoid the contact with the social well-being. So we should do compulsory yearly eye checkup whenever they come for your vacation. We always tell in summer vacation, you tell the patient to do at 3 things in vacation. One is a dental checkup, one is the eye checkup, and third is a flu shot. So that has to be followed in our practice as a general pediatrician, which we follow since years. And once you diagnose on clinical history, take the help of your pediatric ophthalmologist. You can do the visual acuity to see from how much distance they are able to see the clear vision. You can go for the refractive test by your pediatric ophthalmologist. And in some patients, you should always go for the look for the retina or cornea by doing a retinoscopy. So diagnosis by as a common pediatrician is in your hand. You can do basic visual acuity at least in your OPD setup. I think you should have a Snellen chart in your OPD, and then take the help of pediatric ophthalmologist for the diagnosis.
Thank you, Dr. Deshmukh, sir. It appealed me that you should have a team of friends of this ophthalmologist, dentist, and ENT surgeon also, so that when time comes, you can consult them to move forward for these adolescents, which should get treatment as early as possible. Now, Dr. Mahapatra, sir, Are you there? Dr. Samren Mahapatra, sir, which is better, glasses or contact lens?
Madam, around 25% of Indian population are adolescent. And out of that adolescent population, and around 30% have myopia. And so definitely we have to prescribe a glass or a contact lens. So glass, some of the adolescents, they like. And suppose some adolescent, they play cricket, outdoor sports, they may not like glass. And also hygiene. This is one of the most important things. If you are prescribing a contact lens, it should be cleaned properly, and it should be the hygiene should be the best. Should be hygiene should be. You should maintain the proper hygiene, and also few of the adolescents are not compatible with the contact lens, and they usually take more time to adapt. This is also a problem, and also contact lens cost.
So Dr. Samrendra sir said very rightly that in the first slide only I had told that 80% of Asians are suffering from these childhood blindness, and the reason behind is first is the screen time, and second is the bad eye hygiene habits. That is also has to be taken. Genetic plays a role, but these two is the most important thing for the myopic child and the childhood blindness. So can you say the difference between glasses and contact lens, Dr. Mahapatra, sir?
Glasses, madam, it is easy to use, and cost is less, cost effective. And nowadays, the adolescents, they are using various stylish frame. So these are the few advantages of glasses. But in contact lens, the field of vision will be wider, and comfort during activities, and also cosmetic appeal, particularly for adolescent girls, and also convenience. And if the adolescent boy or girl is having irregular astigmatism, then better to go for contact lens.
Thank you, Dr. Mahapatra, sir, for this explanation. Now, this question is for Poonam ma'am only because he's a ophthalmic surgeon. Then what is LASIK surgery, Dr. Poonam ma'am? Dr. Poonam ma'am, are you there? Dr. Poonam Singh ma'am, can you hear me?
Yes, can you hear me?
Yeah.
So, as sir already explained, there are persons where the glasses are most comfortable, but if the power is more, the contact lenses are required. But still there may be a power where the not only for cosmetic purpose but also for some professions like people who want to go for sports, people who want to go for swimming, for air force. So there are some professions where high power is not allowed. So this is the area where LASIK has come as a boon. It gives that wow factor, and it has become a OPD procedure. So LASIK is laser assisted in situ keratomilius. By keratomilius, we mean kerato means the cornea, and milius means reshaping. So reshaping of the cornea is LASIK, and it is a type of corrective refractive surgery which can be done for myopes, hypermetropes, and astigmatism. Of course, there is a limit up to which in myope up to maybe 10 to 12 diopter, and in hypermetropes and astigmatism up to maybe 4 to 6 diopters we can correct by doing LASIK. Why so? Because there are certain factors which have to be there to do LASIK, and beyond that we cannot go for this type of surgeries. Although there are certain different surgeries which are available for these kind of patients. So, who are the people where we can go for LASIK surgery? One is that the patient's age should be 18 years. 18 years. Why this 18 years is important? Because as the child is detected to have refractive error, the parents usually ask us that will it be this much only or will it increase over a period of time? So we usually tell them in myopes especially that as the child will grow, his size grows, his eyeball size grows, so there is a likelihood that the patient's myopia might increase. So it is expected that by 18 years of age, he will reach the adult age, and probably now whatever changes have to happen, they have happened. Now further, no more changes in the refraction will happen. Stable vision over the last 1 year is important because if the patient is having a simple myopia or if he is having a progressive kind of refractive error, so if the last 1 year is stable, that means we don't expect one change. These days, all the surgeries have become medico-legally very important. Whenever the patient is going for such costly a surgery, you have to give him some assurance that this is what is going to happen. Suppose that the refraction is changing, so he was definitely going to ask you that once you have done the surgery, now next year the power will change. I had done it for my chashma to be removed, and again I have to wear it. What is the point on spending that much of money? This is corneal thickness. This is the major important factor in doing LASIK surgeries, because cornea is the area where we are working on in LASIK. Corneal thickness is basically 550 microns, and basically, as you can see the pictures above, in LASIK, a flap is removed from the cornea, and the laser it is a OPD procedure where the machine is fixed with various the settings, and the laser is given to flatten the cornea so that the refractive error is reduced. But if the cornea is already thin, that means we cannot further thin down this cornea. These are the patients where we cannot go for LASIK. So corneal thickness is important. So any patient who goes for LASIK, the whole eye examination, including his slit lamp examination, his retina, his OCT, the total examination is a must, because you have to tell him what is the outcome which is expected. Also, eye health is important, because any infection will definitely be very difficult to deal with, especially after having this kind of surgery done. So basically, LASIK is a very wow kind of surgery, and improvement can happen over a period of time. Very early, maybe 4 to 5 days or a month, but we have to be really careful.
Now, Poonam ma'am, please explain what is the benefit of LASIK surgery, and we have to move fast because the time is constrained, ma'am. We listen to you, but we have to be little short.
As it's already written, the LASIK benefits are definitely we are doing it for refraction purposes. So vision is improved, and it is a quick type of like the patient does not have to wait for a longer period of time to see the results. And minimally invasive means that it's a OPD procedure, and like I said, and definitely no procedure is beyond the risk. So definitely, as we are working on cornea, some corneal nerves will be damaged. The patient will have dry eye. Some infection may happen, although rare, and under and over correction is likely. So you have to explain the patient. Even though at present moment of time the refractive error is corrected, maybe over a period of 1 or 2 years, some refraction might come back. Although in recent femtosecond latest type of LASIK, the flap complications are rare, but definitely it is to be kept in mind whenever we are going for it.
Thank you, Dr. Poonam ma'am. I think we need a separate session on this. So sorry for saying this to be short. And eyes are window to soul and strength. We all of us know. So please take care of your eyes and your adolescent's eyes. Now, what is allergic conjunctivitis, Dr. R.N. Sharma, sir? You have to be.
Yes, ma'am. As we know, itis means inflammation. Allergic conjunctivitis means conjunctivitis due to allergy. And conjunctiva is the thin membrane layer, transparent membrane that lies the inner surface of the eyelid and covers the white part of the eyeball, that is sclera. And this is due to maybe due to simple allergic conjunctivitis or due to allergens, irritants, and bacterial, viral, so many types of the conjunctivitis is there. The causes of pink eye is allergens. Allergic conjunctivitis mainly outdoor allergens like pollens, dust mites, pet dander, mold, and other environmental factors. These are the allergens. And seasonal variations in the spring and summer more common during peak pollen seasons, and maybe some genetic predisposition of allergic history, and atopic dermatitis may be present in the allergic conjunctivitis during history present. Types of, that is, seasonal allergic conjunctivitis occurs during peak pollen seasons. Already seen is outdoor seasonal allergic conjunctivitis means outdoor pollens, and simple allergic conjunctivitis means that is limited to the only eye and eye symptoms only. And in the hay fever, perennial allergic conjunctivitis occurs year around and often during indoor allergens like dust mite, pet dander, etc. So this is seasonal means outdoor pollens, etc., outdoor allergens, and perennials may be measured due to the indoor allergens, and vernal keratoconjunctivitis, severe form of the chronic form of allergic conjunctivitis, often affected children and young adults, and this may be due to the contact lens, use of the contact lens and other foreign body in the eye, and maybe conjunctivitis, allergic conjunctivitis and other irritants may be due to conjunctivitis, can be caused by other irritants also. Next page.
So we need to take care of non-living and living pollutant in our household and surrounding also. Now, how will you diagnose and manage this allergic conjunctivitis? Dr. Deshmukh, this is question for you.
Yeah,
Dr. Deshmukh?
as Dr. Sharma sir told, it's a typically allergic condition which is related to the all allergens in the atmosphere and exposed to the eye, which cause irritation to the eye. And the symptoms are very basic. The child may have redness, itching, burning, continuous water discharge. Sometimes the baby may have the swollen eyelid and blurred vision. So basically, the child has all the symptoms which relate to the exposure to allergens without fever. And if you want to manage, the best treatment to manage is to avoid allergens. So you have to tell the parents to avoid the contact with the rampant air pollution, try to avoid to go outside in the peak pollen seasons. They can use the child from the allergens from the environments. They can have frequent eye wash. Or they should have the cold compression frequently. They can use the anti-histaminic eye drops to relieve the itching, redness, and swelling. In severe patients, we can use the Marshall stabilizer as per the recommendation by the pediatric ophthalmologist, take the help. But if the patient has severe allergic conjunctivitis, we always go for the topical cortical eye drops. The doses we can discuss with your pediatric ophthalmologist. We have to use for the shorter duration only. If after giving shorter duration course, if the child doesn't have any response, always refer to patient to pediatric ophthalmologist. In severe patients, nowadays the immunotherapy comes, but they have the limited roles. The immunotherapy, it is available in the sublingual and subcutaneous form, but this therapy is reserved for some selected patient. Never ever start. We don't take the help of allergic specialist or pediatric ophthalmologist in your setups. So these are the basic things we can keep in the mind to treat the allergic conjunctivitis.
Thank you, Dr. Deshmukh. In the picture, you can see usually the allergic conjunctivitis is of pink eye. It shows as a pink eye and it is bilateral. It is usually bilateral. So thanks, Dr. Deshmukh. Now, Dr. Mohapatra, how will you manage this bacterial conjunctivitis? Please be short. Please in short. Dr. Mohapatra, sir? Dr. Mahapatro, sir? Are you there?
He is there. Unmute कीजिए sir.
Yeah. So bacterial conjunctivitis, madam, mostly we will give antiviral, local antiviral medications. For bacterial, mostly we will give local antibacterial ointment or drops. And for viral, particularly if you are suspecting herpes, then we have to go for antiviral medications locally.
Okay. Anything else you want to say, sir?
And other things, we have to take proper care, hygiene, and hand wash, all those things.
Thank you, sir, for being very short. And we are having really constraint of time. Now, tell us about bacterial conjunctivitis also, the red eye.
Yeah, commonly known as red eye. And the treatment is local antibiotic. And sometimes in severe cases, we may go for oral antibiotics, and particular local antibiotics. Previously, gentamicin eye drop was available, and tetracycline, and nowadays we are using moxifloxacin left and right.
Yeah. Thank you, doctor. Anything else you want to say?
Yes. With this hygiene, hand hygiene.
Thank you, sir. But I think we should consult our ophthalmologist friend also for this, because the complications are happening, and because of those consumer forum cases and all. Because of bacterial conjunctivitis, usually unilateral, you can see and make it out. Now, what is the difference between allergic and infective conjunctivitis? Dr. Poonam ma'am, this question is for you. Dr. Poonam ma'am, are you there?
I'm there. As already explained in the previous slides, the allergic conjunctivitis will have.
I think everyone can hear her. Dr. Poonam ma'am?
Yes, can you hear me? Hello?
Yes, ma'am. Little louder.
Yes, Poonam, you're audible.
Already the previous slides have explained the situation of allergic and infective conjunctivitis. So nothing more to add except that wherever there is a purulent kind of discharge, it is basically infected. And where there is a more of a congestion, redness and itching and a watery type of discharge, it is more of allergy, which will happen. There will be always a history of some atophy, some bronchial asthma in some patients, some pollen allergy, something which we have to find out. And treatment already has been discussed in the various slides. So nothing to add here.
Okay, thank you, Dr. Poonam ma'am. So please take care of eyes, yours and adolescent, because it is very important. And it is a window of your soul and strength. Thank you. What is strabismus, Dr. Aryan Sharma, sir?
Yes, ma'am. Strabismus is referred as a crossed eye, lazy eye, or squint. It is a condition where the eyes are not properly aligned and point in different directions. One eye may look straight ahead while the other turn inward, outward, upward, or downward. This misalignment can be constant or maybe intermittent, and it can be switched between the eyes. And there are 6 muscles of the eye in our each eye, and the type of strabismus is eye esotropia. It means turn inward. Both eye or single eye turns to the nose side. This is esotropia. Exotropia, both or single eye turns outside. And hypertropia means eyes may be upward, and hypotropia means in downward. And symptoms may be crossed eye, double vision, eye strain, head tilting, difficulty with depth perception, already described in the symptoms of refractive errors. And causes may be genetic, familial history, or brain disorder in elderly, Stokes cerebral palsy, or tumors, eye muscle problem, weakness or imbalanced between muscles, and refractive errors, as already said. And the main, both eyes are not able to focus. The muscles are not focusing and sending the wrong information to the brain. so that there is the involuntary movement of the both eyes, and vision is defective, and it may be double vision may be produced, and it can be called as if their amblyopia, lazy eye, and all other these are the main definition of strabismus.
Thank you, Dr. Anand Sharma, sir. Now, Poonam ma'am, will you tell us how will you manage a strabismus case, because you know that it will lead to amblyopia and complete blindness? Dr. Poonam ma'am?
Yes. Actually, the treatment of strabismus will depend upon what is the cause that is causing, what is the pathological condition which is causing. It is due to some muscular cause, some neurological, some brain center related issues, or some local cause like thyroid or something. Accordingly, we will act on it. So basically, the treatments which are available are, if there is an anisometropia, like if there is a glass related issue, one eye is having more power, the other is having less power. So the correction can be done with the help of glasses, power, or contact lenses. Prisms, if the power is very high, prisms help there. And eye patching is something which is a combination of amblyopia or strabismus, and also surgery. Actually, squint surgery is basically a tailoring kind of surgery where a resection or a recession of the muscle can be done depending upon what kind of strabismus is there. And finally, the only thing which I would like to tell here is, which will be important for this forum, is patient is having vision 6/6 in both the eyes, is still having strabismus, and this patient wants to go for some kind of surgery for cosmetic purpose. Now his fixation in the deviated eye is also developed at one foveal point. We should tell the patient that initially after getting the surgery, he may have diplopia for some period of time. This is something which I wanted to share with you all, because any patient going for strabismus surgery with good vision in both eyes but a deviated eye will have some kind of diplopia for initial some period of time after. So that's all. There are certain vision therapy softwares available these days which help the patient to improve his weaker eye so that the refraction improves. So that's all for strabismus management.
Thank you, Dr. Poonam. You shared a very important piece of information to us, and we would like to have a complete session for you. Thank you. Now, what is amblyopia, Dr. Deshmukh?
Amblyopia is we also call as a lazy eye, and basically this is a one neurological disorder which happens before 6 years of the age, and the most common cause is the brain favors one eye or the other. So one eye has a stronger vision as compared to second eye, and that's why what happened, it will affect the vision of the kid, and the kid doesn't have the what you call as a depth perception. So there is a impairment in the binocular vision, and the most common causes, as rightly tell, the first cause is the squint because of the misalignment of the eyes. Sometimes if the kids have the difference in the vision between two eyes, they also have the amblyopia-like symptoms. And if some kids have the congenital cataract or ptosis, there the vision is affected, and the one eye is overpowered by the second eye. So these are the things, and the treatment-wise, it has to be done for the patch therapy and the close therapy.
Dr. Poonam ma'am, will you be explain briefly about this management of amblyopia? Dr. Poonam ma'am?
Yes. I would just like to touch upon some of the factors which are not there in this slide. As already has been told that the patch therapy is important, because what we are doing is basically what is the difference between amblyopia and strabismus is that strabismus is basically a muscular problem, and amblyopia is a problem where there is a connectivity between the visual and the brain is not there. So now what we want to do is we want to stimulate the eye so that the eye sees better. So patch therapy is something where the better eye is closed so that the weaker eye will work more, especially for near kind of, and the activation will help the coordination between the visual axis and the brain. Atropine therapy is something, we all know the atropine is a dilating kind of drop. Once we put the drop in a good eye, that eye will not be able to see better. So the other eye, which is the weak eye, will work more, and so it may improve. In glasses and contact lenses, these days, So what important points I want to say is that if these frosted glasses are available for, it will be difficult for the child to put on patches. So some glasses with frosted glass on the eye, which is better, so that he is forced to see with the other eye, makes him better use the glasses. Surgeries are also available, but 2-3 things which are important, not in this slide, is one is that now there is no age limit for amblyopia. Previously, it was told that till 11 years only the amblyopic patients can improve. Now, any age patients can improve amblyopic patients. So we should not give up on them that no, now after 11 years, nothing can happen. There are certain vision therapies available, some softwares available, which the patients can take at their home, do in their computers, and their vision will improve in these softwares. Another one thing which I want to say is that as a pediatrician, you will be seeing some patients, like sir told in the previous slide, if you see a congenital cataract patient, the patient has to be operated at the earliest, because that congenital cataract eye will develop amblyopia because the child is seeing for the other eye. If there is a ptosis, it has to be operated. We have to eliminate all the visual deprivation factors from the eye. There are certain medications, this is the last point, like so there are certain medicines also available which do help in amblyopia. That's all.
Thank you, Dr. Poonam. Now, I will request Dr. Mahapatru sir to enumerate the common eye injuries in adolescent, because we are running short of time. Only enumerate, sir, please. I'm sorry for that.
Most of the adolescents, they have a behavior that is risk-taking behavior. That's why they are more prone towards accidents, and sometimes the major injuries, globe rupture, orbital fracture, and later on traumatic cataract, retinal detachment. So these are the few of the major problems. Other problems, corneal abrasion and chemical injuries. It may be due to some alkali or acid or some solvent, and sometimes subconjunctival hemorrhage, and sometimes traumatic iritis. And the other things, the other injuries that already we have discussed, the orbital blowout fracture and penetrating foreign objects, eye laceration. So these are the common eye injuries.
So thank you, Dr. Mahapatru sir. This keratoplasty has to be taken by Poonam ma'am, but I think this is a very vast topic. So we'll have a other session for, is it okay for Poonam ma'am, because we are running short of time? Or you want to enumerate it? Poonam ma'am?
Dr. Rashmi ji, the youth is waiting.
Yeah, that's what I was saying. We can close down keratoplasty, we can take in another time.
Ma'am, she can just say one line or 2 lines, ma'am.
Yeah, Poonam ma'am, please. Indications you can say, ma'am.
Yes.
Indications of keratoplasty.
Is only working on patients. The corneal degeneration is there. It will not work in any other patient. The eye has to be better. That cornea, these days it's not only one layer of cornea which can be removed. The corneal various layers can be taken care of. And how do we take care? There should be some cells available in the hospitals, gradient cells, which should motivate the patients, especially who are in peak and all those TCU, ICU, so that more of the corneas are available. They can talk to them, because that is a condition they should take care with their emotional condition in mind. They should talk to them so that and prepare them that they can go ahead for the corneal donation. That's all, ma'am. Thank you so much.
Thank you, Dr. Poonam. I'm sorry I had to rush with this slide. So you should take care of your eyes. That someone would say your eyes is a fairy tale for me. Thank you so much. And thank you, Dr. Deshmukh and Dr. Mahapatru and Dr. R.N. Sharma also. Being not an ophthalmologist also, still you spoke very well. And sorry for my initial that, because I thought I should say about these panelists nicely and read it out to shorter the time, but I took time. I'm sorry for that. And thank you very much, the organizers, for giving me this opportunity. Should I stop? Shamiko, sir?
Shami.
Yes, please.
The youth who's waiting for a long time. Dr. Suchitra is joined.
Yeah, ma'am, I'm here.
Yeah, Dr. Suchitra, please put your video on.
Good evening, ma'am. Yes.
So, Dr. Shamik, please introduce her. She is a professor of pediatrics from Nilofer Hospital.
Ma'am,
And
you'll
she
be the
has-
best person to introduce her. You know her best.
Yeah, she is one of my, I should say, my mentee, and one of the most sincere, most hardworking persons from Telangana. And she's progressed herself from being assistant to associate and now professor at the biggest institute of child health, Nilofer Hospital. And she's a secretary of the Twin Cities branch now. She's the upcoming leader in IAP. So she's part of our AHA. She was the secretary of the Adolescent Health Academy, Hyderabad branch. And now she's working at the IAP level. We welcome you, Dr. Suchitra. And we request you to kindly go on to most awaited session to interact with our youth, because these young people, we want to know what is his perspectives about eye and the spectacles and many of the problems they have. Please go on and welcome the youth for us, who's the heroine of our session.
Thank you. Thank you for such a long program introduction about me. I'm still growing up. Like, as you said, it is a learning session for me all through. And I thank all the AHA members for this day, because if I start telling the names, it takes too long. Thank you one and all for giving this opportunity. So starting with, we have few questions from Sonavani. Is Sonavani here?
Yes, ma'am.
Beta, video on karo.
Yeah, you can start. Yeah. Where are you?
She is
I
the
cannot
daughter of our pediatrician from Nasik.
see.
Yeah. Yes, yes, Suchitra.
Yes, ma'am. So she has posted me few questions to be answered. So if I can take in front of you, it's okay, or should I keep it as a presentation? What would you like to go ahead?
You may ask her whatever, be spontaneous.
Oh, yes. So listening to this talks, Sonavani, are you listening to me?
Yes, ma'am.
Yeah. So from these talks, would you say still prefer to go with the contacts or with the glasses? What did you understand from this?
I think it's a personal choice for most of us because it really comes down to the psychology of the child. It's not really about, so teenagers usually really care about how they look or what they are perceived as. So it's really just a personal choice for everyone. For me, it has been glasses for a long time because contacts just seem too much of a hassle to me. And teenagers usually do prefer something that is really convenient for them. So, yeah.
Yeah, that is true for the perspective of a teenager when you see that which is comfortable and convenient to you. So if you say glasses, what we medically say that is the peripheral vision, because you have a frame. When you have a frame, your peripheral vision will be little bit coming down. So you will not be able to make out that. So, but with contact lenses, this problem will not be there. So it is easy for them. So they prefer more of contacts, and it depends upon the activity that you do or the kind of work that you're exposed to. Adolescents, mostly if they're into sports, they need to go for contacts. It is not with this. But based again, if you're a scholastic performer or if you're college going teenager, so there you are supposed to decide on your things, like how you can maintain the hygiene. Because we have daily usable or reusable things. Reusable means you have to store them every 2 to 4 hours. You need to carry the solution. You need to place them back. So this is a little cumbersome when you use the contact lens. Glasses, most of them feel comfortable unless you are conscious about your skin, where your nose gets strain marks, or the type of glasses that you use also at times may cause some difficulties. So it is always a choice of the adolescent, but we give the proper things. This is what we can tell. So it is the choice of the youth that have to decide. That's well and good, but using of
You're on
contacts is
mute,
not.
Dr. Suchitra.
Sir?
You're on mute.
No, sir. My audio is open.
Yeah, I can hear you.
You're fine. You're fine.
Yes. Yeah. So now, Vaikari, like if you see that the screen time which was discussed here before, so what is your perspective about the screen time? If a child, if an adolescent of your this thing If you're watching the screen throughout the day for your classes or sessions, whatever you're attending, so how would you feel about your eyes to be strained?
Again, speaking from a youth perspective, I think it's kind of inevitable to not be in front of the camera because a lot of stuff, even if you're in the JEE NEET sector right now, all your after classes, all your mock tests, everything does come online. And so it's just inevitable. The screen time is so after the 8 hours that you go to class, the rest of the day you have to be in front of the screen. There are classes, there are everything. So I think one way around it could be the blue light uh, protectors. But I don't think that the screen time could be reduced. I mean, social media is something different, but given the situation, given the education sector now, how it's progressing, it's kind of inevitable to be away from screens.
Yeah, that's very true that in youth that you are supposed to, because of your education system falling in place. So that is when we were told in the previous sessions wherein how to use a screen and what should be the time. If you're not able to move out from that, just simply shut down your eyes. It's just like shutting your screen.
Yeah,
Shut your
the
eyes, the natural
2020
screen.
system.
Yeah, your 2020,
Yeah.
keep following 2020, and that should really work out for you when you are not. Otherwise, watch out from your windows whenever it is possible. Watch out from your window, a distant object, and then look at that object for at least 10 to 15 seconds. Then turn off that and close off your eyes, and then again open your eyes when you see a near object. So this keeps an eye exercise for you. This also is good for you. And screens, as such, the light blue lights and the screen to be covered. These are the proper things that you have to take care when your eyes should not be strained. That's well good taken. So what would you say, like when you are sleeping overnight, like late nights with a screen time on, and morning when you wake up, you have kind of things. What are the things that you usually face with? You say, I didn't have the sleep, or your hangover type of things you complain about. You didn't get sleep because you're exposed most of the screen time.
Yeah, that does happen. And I think a lot of teenagers have now adopted the no screen time before bedtime system. So like for 1 hour before they do not watch screens. I think that's really prevalent now. But yeah, it does happen. So for me, when I have to work late nights during my internship, so till like 2 a.m. I cannot sleep. I physically cannot get myself to sleep. I just waste the whole night, and then the next day I'm really, so first of all, I'm really anxious, and then I'm also physically very ill. So I was traveling and I was throwing up all the time. So I really like, I think it really does physically affect you. So yeah, screen time does do that to you.
Yeah, that is what you have to restrict to. The screen restricting means it's not like keeping away. Sometimes you can shut down your screen and have your audio things on. So you can listen to the things and change it, switch and on and off. That is one good thing. And second thing is like most of the nights when you're listening, see, daytime is your screen time is good, but nights your screen time has to come down. That's what we say. Dim lights are better preferred, or don't get exposed to very heavy lights during the night. This will always cause your sleep pattern to be disturbed. So don't disturb your sleep patterns. That will keep you better. And rubbing of your eyes. Now, if I say that someone is allergic, like your age, usually youth are most exposed to these chemicals and all, whether you apply to the face, you are apply the sunscreens or any lotions, you are allergic to that. So how are you feeling about that with the eyes? How to protect your eyes with that?
I think even with makeup on, I think you rub your eyes a lot because of the external stuff that you apply. So yeah, I mean, I even asked you that question, right? Like, is rubbing my eyes really affecting my eyesight? So I really need the answer to that question because again, it's sort of given the beauty standards and stuff, it's sort of again feels inevitable not rubbing your eyes. Uh, so yeah.
Yeah, that's what. When you rub your eyes, you have to be a little watchful. Rather than rubbing the eyes, you have to look for things like a fermentation that you can keep, a cold compress or a warm compress when it is hurting and when it is like, when it's not too much of irritation. Because once you start rubbing it, the itch intensifies. the histamines are released more, what we call, and then that intensifies your itch and you rub more. And your hands, wherever you keep and rub it, that's what infections do prevail. And dark circles are the other thing that is more prevalent in the girls right now, what we are seeing. And your makeups always be specific about the things that you use for your eyes, eyeshadows or eyeliners or whatever you're using. Youth are more into that, especially the girls. So you have to be a little watchful about what you're using, and then you can protect your eyes better. Yeah. So some more things from you, Vaikri? What you expect from?
Yeah, so I actually wanted to tell you about why youth generally does not care about their eyesight right now. There are a few reasons. I mean, there's some stats. So 60% of teenagers actually do not care enough to get their eyes checked until they can't physically see the whiteboard. So that's a huge stat, and WHO says that till 2050, almost half of the population will be myopic and teenagers will be leading the charge. So I think the main reasons for these are like we think we are invincible because right now if we are not facing the problem currently, we think it won't really affect us in the future. I'm young, my eyes are fine, and because there aren't any immediate consequences, it's easy to think that it won't happen to us. Also, immediate gratification is what we seek. So, scrolling through social media or playing video games gives us a quick burst of pleasure. Taking care of our eyes and thinking about preventing problems is like much less exciting and it seems more distant. So it's just how our brains are wired, and it's also the pressure to fit in, like we talked about. It's about social image. It's wearing glasses or contacts seems more nerdy. It seems uncool, so usually people just shy away from that. It also sometimes happens that we misread the signs. We actually brush off our eyesight issues, saying that it's just fatigue or I'm just tired or I just need sleep. So stuff like that. Yeah, that's all.
Yeah, that's well taken from you, Vaikri. That's yes. Definitely, adolescents also should have the eye checkups very frequently. It is not like when you have a problem, and don't always attribute your screen time to being getting tired or not having sleep. But your eye vision has to be checked up because the way you're concentrating more on the studies as your so myopics can be picked up early. But because adolescents, we don't usually see the hypermetropic, but yes, definitely there also are certain conditions with your cornea, so you have to be knowing like when you're having different kind of visual things. Also sudden onset of the strabismus. So you have to think of headache and sudden strabismus. It's not right. So medical checkups have to be done, wherein sometimes some of them may be having some tumors inside that also may lead to such kind of presentations. So never neglect what hurts you, because pain is one indication for you or discomfort is one indication where medical checkup has to be done. So you have to take care of that. Yes. Is it? Yes. So, yeah, almost all your questions have been answered. About allergies, I think you're very clear. When you have a dry eye, what would you be doing it? When you have dry eyes, what is the thing that you are going to do?
Blink more and not rub my eyes.
Okay. Anything else that you're taking care? If your eyes are dry, you cannot, yeah, they become red. So what would you do usually, or how would you suggest your friends? Should they carry something every time to put the drops in, or what measures?
Yeah, they should carry the top, yeah.
Yeah, they should carry that. Yes, that is always good whenever the dry eyes. Remember, dry eyes are not always because of your allergies alone. So your nutrition also carries, and adolescent age group especially, they lack the nutritional concepts. So you should also take care of your vitamin supplements, like in your natural food that you are eating. And then fresh fruits and vegetables, colored fruits and vegetables will keep your eyes also moist. This keeps a better thing. So your take home should be on that stage. Yes. So we talked about the contacts and the glasses. We then spoke about even the rubbing of the eyes, lack of the sleep, or long screen time. Then we had issues regarding headaches, which are not prompt for the screen time. And then we even spoke just now about the nutrition that you are supposed to. So these are all the pointers towards the youth. So what else are you?
वो वीडियो में इशू आ रहा है, वीडियो में इशू आ रहा है, क्या है वीडियो में इशू बता रहे हैं
Somebody can mute Dr. Syed.
वो दूसरा दिखा रही है.
Yeah, Vaikri, with this few things, do you still have any eye issues that you want to get cleared through this session?
So I think it's yeah, so I have two questions. Does eye power actually reduce with consistent use and consistent use of contacts or glasses? And yeah, I think that's the only question.
Yeah. Eye power. Yes, Dr. Poonam Singh ma'am is smiling at it because eye power, once it is there, it doesn't come down as such. Because once got a power, you have started using it, and regular usage definitely keeps you improvement side is like you don't quite often need to change the glasses. So maintain your eye hygiene, sleep hygiene, that is very important for the adolescents. And once you follow this and the nutrition part that is taken care, eye exercises, that is very important, and don't strain yourself. That is what you can be taken care of. Because this is something also a hereditary thing. It's not only just because you're exposed to the screen time more. And always choose the best what suits you. It is individual decision that you have to make, because how you maintain. At certain age, you are not able to decide, but at one point of time, more than 16, the teenage, the older teens that we call them, they can well manage with the hygiene of having the contacts and the material also. Because previously specs used to come as a glasses. They are the glass materials and they are safer. But now even the specs are also of the plastic. So the plastic that you see outside that gets scratchy, and you see through the scratches, and sometimes you don't even to change the specs. How often to change and why to change, and you continue with the scratches because you keep throwing them here and there. So better than that, always it's good to go for the contacts when you can maintain them, hold them better for a good time, and keep changing the contacts.
Got it.
Because they have good peripheral vision and you don't have extra problems coming up in.
Got it, ma'am. Thank you so much.
Hima, ma'am?
Yeah.
Yeah.
So thank you. I think so nice, Suchitra, you brought up all the youth-related issues from a young person. Vaikari, how are you feeling?
I'm feeling great.
Good. So please, you are part of our AHA Youth Forum. Please be part of us. And really thanks Suchitra who's come forward to interact with you. And I also thank all the panelists and Dr. Rashmi Gupta and Dr. Samarendra at last. He's just joined us at a short interval. Dr. Sanjay Deshmukh, and we had apna own R.N. Sharma ji. Thank you, sir. And of course, our two specialists, Dr. Poonam Singh and Dr. I'm also afraid to take his name. Sir, Dr.
Love Kawai.
Yeah. Thank you for his presence. And of course, Sanjay Deshmukh, thank you so much.
Thank you, madam. Thank you very much.
Yeah.
Thank you to you all.
So these topics are very unique. We wanted to go a little different this year. The other topics routinely we cover in many other modules and many areas. But I think these are the topics which are missing, and adolescent ophthalmology, keeping the body image issues, the digital exposure in mind. We thought we should discuss it. I thank each and everyone. And over to Dr. Arya and Shamik for the closure. I think there were a lot of questions in the chat box. Quickly, if we can take up that.
Thank you, ma'am. I'll just go through some of the questions.
Yeah, quickly, just because we are already short of time.
There's one question from ma'am, Dr. Shubha Badami. What should be the cutoff value of myopia for doing LASIK? I think so, Dr. Kachwai or Dr. Poonam Singh, one of you can respond to that.
For LASIK, generally, maximum what we can go is 8 or 9 diopters. But that is not the only thing. I was seeing the presentation. I didn't want to interfere in between. we have to look at the chances of corneal ectasia post-LASIK. So for that, even children, they are adults now, beyond 18. So even those with lesser power get rejected after corneal topography if we find that there are chances of ectasia. But broadly speaking, the maximum limit generally comes to -8, 9, not beyond that. Beyond that, we have other options like ICL or the lens which is implanted inside the eye.
Thank you, Dr. Love. Dr. Shanta Chattopadhyay has a question. Is there any simple test to detect dryness of eyes that can be used by a pediatrician? Dr. Love, you can respond to that.
Tear film breakup time is very easy. If you have a fluorescent strip, just you have to put at the lower fornix and see the fluorescence on the cornea surface and how many seconds it is taking to break up. So that is one of the very common things what we do to assess dry eye.
Thank you, Dr. Love. You've already answered the question of Professor Sudhir Mishra on what are the medical indications for LASIK surgery. And
cosmetic.
Can you just elaborate on what is cosmetic? What do you mean by cosmetic?
LASIK doesn't provide any added advantage over a contact lens in terms of function of the eye. But if a patient doesn't want to use contact lens or spectacles, then the option of LASIK is there.
Right.
Functionally, it is not improving anything in the eye.
I think so. That concludes the questions. The rest of the comments are all very much in praise of the whole event. Thank you so much to the audience and to all the speakers and to all the senior dignitaries who constantly encourage us, find time to appreciate all the efforts that have been put in. We are trying our level best to address new aspects of adolescent care. Ophthalmology was pending, and I'm sure today, thanks to Dr. Love Kachkawai, Dr. Rashmi Gupta's moderation with eminent panelists, and of course, we had this wonderful youth voice who talked about their perspective, their perceptions as to why they don't feel motivated enough. And it's only by making them aware of where they should be seeking the help of the doctors can we unearth their problems. Thank you very much. Next month, very soon, we will be announcing the next adolescent super specialty
Next topic
webinar.
is on dentistry, Dr. Shamik.
Yeah.
Adolescent
I was
dentistry.
just going to say that, ma'am. That next is we're going to be talking about adolescent dentistry. I'm sure many of you would be interested in that. Do join us once again, and wishing everybody a very happy weekend. But over the weekend, AHA is still very, very active. Tomorrow, we are starting a very, very, very stimulating online program on adolescent counseling. We have more than 150 registrations for that. So it will be a long program every week. Yeah, it's like a course, and you will be certified at the end of it. So those of you who have registered, please log on tomorrow. And come Sunday, we should be again welcoming our very, very vibrant youth who would be carrying out this particular month's program, Wave 18, and that would be on parenting. And I'm sure with all these adolescent academy activities, many of us can participate. It's not just a few. We are trying to make the program such so that the maximum number of AHA members can participate and be a part of the Silver Jubilee celebrations. Thank you so much to everyone. A very, very good night, and hope to see all of you again. Thank you.
Thank you. Thank you.
Thank you, Dr. Shamik sir. Dr. Hemant madam, thank you.
Thank you, Sanjay. Thank you. All of you done so well.
Thank you,
Dr.
ma'am. Thank you, Bindu ma'am.
Dr. Sharma sir.
Thank you.
Thank you.
Thank
you.
Thank you.
Thank you. Thank you. Ravindra ji, thank you.
Thank you. Thank you, everybody.
Thank you, Madam
Thank you,
Muskia,
Sneha.
madam.
Thank you.
Thank you.
Very nice. Very
And
nice.
thank you,
very
Rashmi
nice
ma'am,
webinar.
for nice moderation.
शर्मा सर बहुत अच्छे से बोले आप सब बहुत
Ravindra
अच्छा
Sonavane, we enjoyed your daughter's presence.